Prenatal teratogens causing fetal abnormalities. What you do, your baby does, and what you consume, your baby consumes. Many women who don't know they are pregnant have already consumed some toxic that could affect their developing fetus. The prenatal period is the most important period during your pregnancy. It is when your baby develops his or her nervous system and facial features. Imagine going into your ultrasound to confirm your pregnancy and you see that your baby is abnormal. That would be one of the most devastating things that a pregnant woman would have to deal with. These abnormalities could be a result from exposure to prenatal teratogens. 3 common types of teratogens pregnant women consume before or even during pregnancy are alcohol, tobacco, and marijuana. Recent reports on alcohol, tobacco, and recreational drugs such as marijuana use now show that there is probably no safe amount of exposure. Alcohol is one of the most commonly abused substances during pregnancy. A study from the National Institute on Alcohol Abuse and Alcoholism says that 20 to 30% of pregnant women drink at some point during their pregnancy. Mothers may ask their doctors if they could have a glass of wine here or there during pregnancy, and until recently, doctors thought that it was okay or even recommended. But studies by Fieldman and others, however, show that there is no recommended amount that is safe to consume while pregnant. Even knowing what could happen to your baby, some women continue to still drink during pregnancy. If mothers drink heavily enough during pregnancy, their baby could be born with fetal alcohol syndrome. Babies born with this problem have a short head and eyes, flat mid-face, short nose, and are underweight. Teachers often find that students with this problem also have trouble paying attention, learning to do simple tasks, following directions, and getting along with others. These children may need medical care for the rest of their lives. Second to alcohol, smoking is another common teratogen. Some women who smoke think that it is okay to continue smoking while pregnancy or find that they just can't quit. Smoking can cause a range of bad outcomes for the fetus and the newborn. Smoking tobacco while pregnant causes a risk for stillborns, infant mortality, sudden infant death syndrome, preterm birth, respiratory problems, and low birth rate. The baby also has a higher chance of becoming addicted to tobacco later in their life. Hammer, in his report on secondhand smoke, finds that if women are exposed to secondhand smoke while pregnant, the baby is also getting the effects from the secondhand smoke, which can cause hyperactivity and conduct disorder. Users of marijuana tend to use tobacco also, and the effects are probably more than additive. The neurodevelopment of the infants is significantly damaged. There are many reports of problems in older children, including the increased risk for mental problems. In a study of prenatal exposure of marijuana, Freed found that in-utero cannabis exposure is negatively associated with the attentional behavior, visual analysis, and hypothesis testing. He says that it affects the baby's executive function, which is responsible for organizing and integrating specific cognitive processes. In light of this information on marijuana, it is associated with significant fetal development problems. It is of our concern that the recent past 2 states of Colorado and Washington have legalized the use of marijuana for recreational purposes. As Cleef discussed in the New Yorker magazine, several other states are considering similar legislation. Many other states have legalized marijuana for medical use, and 58% of the U.S. population are in favor more of legalization. Further, recently, President Obama has been quoted as saying that marijuana is less dangerous than alcohol. Although the White House released reports on the Office of National Drug Control and Policy that clarifies that marijuana is still to be considered of the high potential for abuse, illegal distribution, and the sale of marijuana is a serious crime. Even though marijuana is being legalized in many places, it still has a significant risk of causing many more birth defects as more young women begin using it. Having a baby can be very stressful and a great worry for mothers, but your baby can have a good outcome if you keep your body healthy. As the CDC has recommended for newly pregnant women that they should avoid alcohol, tobacco, and recreational drug use, such as marijuana, which probably have no safe limits, that now that you are becoming a mother, you need to stop your partying habits. Avoiding these common teratogens can help you make sure that you have a healthy baby.